A newly signed executive order by President Trump gives the green light to dramatically accelerate access to new medical research and treatments with psychedelic drugs, including those from plants and mushrooms. Since the 1960s, psychedelics have had the reputation of being illicit street drugs, causing hallucinations, so studying them was legally difficult. But for years, people with mental illness and veterans with PTSD and risk for suicide say supervised treatment saved their lives.
When I came out of this, I felt like I had gotten my life back. That was 5 years ago. I literally lived the best days of my life every single day. I'm so thankful for everybody who's in this room to help out with this.
It fixed my demonic relationship with alcohol. It saved my life, and then it saved my wife. So every day is a blessing. It took about 3 years of, I did it 3 times. It's a different adventure every time. That's not fun.
With this executive order, top addiction and mental health researchers are welcoming the chance to fast-track research, but stress the importance of gathering scientific data.
I was one of those doctors that was not supportive of psychedelic therapy because I thought it was magical thinking. But over the past 6 to 10 years, we have seen an emergence of data that we cannot ignore. These drugs have the capacity, as was mentioned before, with one single administration to change the behavior of someone towards a therapeutic effect.
So for another opinion, we turn to Dr. Mark Plotkin, who founded the Amazon Conservation Team. He's an ethnobotanist originally from New Orleans who's been studying for decades the knowledge of medicine men called shaman.
And only now are we getting past the drug euphoria, sensationalism, and realizing this has real potential to treat, in some cases, incurable diseases like PTSD, like obsessive compulsive disorder. The point is that if this stuff wouldn't work, why would these shamans be using it for thousands of years?
Dr. Plotkin agrees with the research being fast-tracked, but says we need to understand how the drugs work, who will benefit, the negative side effects, and the proper dose.
So, these drugs have potential. They need to be appreciated. They need to be valued, but they need to be handled with care.
They've noticed connections in the brain, neuropathways were recreated. Have you seen that in what you've read and learned?
Absolutely.
For now, doctors say it's important you don't use psychedelics without strict observation by a medical professional. Meg Farris, WWL, Louisiana.
And now there are only psychedelic-like treatments available in private ketamine clinics because the other drugs are not yet FDA approved, but there is a bill in the state legislature moving to create state-regulated outlets for research. For more details, see the link with this story on our website, WWLTV.com.